Good evening. My name is Liz Krueger. I'm a state senator here on the east side of Manhattan. I'd like to welcome you all if you are watching on Facebook or if you have called in via phone. Remember, callers are not allowed to jump into the conversation. Please keep yourself on mute so that you can hear and we can all learn from our special guest. Some people have fed-in questions in advance, and I have those to ask our guests. And some people will use Facebook to type in questions. We will try to get to as many as we can over the course of this evening. Very glad you're able to join us, and I hope you are staying safe. This has been a very exciting week. I want to start by giving you an update of where we are on June 11th, 2020. The state legislature was up in session this week, and we passed a whole package of very important police reform legislation, and I'll be doing a town hall on that in a week or so. Second, New York City has entered phase 1 of business reopening. Construction, agriculture, retail trade, curbside delivery, in-store pickup service only. Manufacturing, wholesale trade, higher education, research businesses, are authorized to reopen. New York City hospitals have been given the authorization to resume performing elective surgeries and procedures that had been shut down for quite a while. In 2 to 3 weeks, we expect New York City will have evaluated itself safe enough to progress to phase 2, using the expertise that we have to make that determination. At that time, offices, real estate, essential, and phase 2 in-store retail, vehicle sales, leases, rentals, retail rental, repair and cleaning, commercial building management, hair salons and barbershops. May I add, everyone is looking forward to the hair salons and barbershops. And outdoor and takeout delivery food services will be authorized to reopen. That's probably 2 to 3 weeks away. City agencies and officials are working on finalizing details for outdoor restaurant seating, starting when we enter phase 2, so that we may go out and eat while staying as safe as possible. This does not change the need to wear a face covering, maintain 6 feet distance from others not in your household, and to wash your hands frequently with soap for at least 20 seconds. Next, I want to remind everybody we're getting close to Election Day. We have a June 23rd primary. Many of you have already applied for absentee ballots. And if you have not, you still have a chance via computer. Go to the Board of Election. You also should know that we have early voting because we passed that last year. And so early voting will start up this Saturday and go through the next, I think, week or so. So people can vote in person, probably not at a particularly crowded primary site during that time. So check your computer for the information about where the local voting is early. If you're on my website, because perhaps you learned about tonight's event through there, it will also provide information to you about where you can have early voting in New York City. Finally, we want you to remember that until June 15th, to sign up for health insurance from the marketplace if you are not currently insured. Many people lost their jobs over the last few months, and so they may have lost their insurance. It's critically important for you to learn about what your options are. You need to go to the marketplace to buy your own health insurance and to learn what options are available to you. You have 60 days to get health insurance after losing workplace health insurance benefits, and you would be surprised how very reasonable many of the options are, particularly making sure that the children in your home who may have lost their health insurance because you, the worker, lost your job, the children are basically guaranteed to be eligible for a reasonable cost health insurance plan. We don't want anyone to go without health insurance in New York State, And obviously, because we are living through a pandemic, we particularly don't want people not to feel that they have the ability to access health care when they need it. An overview for tonight's event. Although we've made a lot of progress containing COVID-19, we still have no control of the virus. We don't have a vaccine, although many are under development. We need to be the smart ones who protect ourselves and our family and loved ones from exposure and coming down with this disease. Tonight's town hall will focus on understanding the spectrum of risk involved with different social interactions and what we can do to reduce our risk of virus transmission to keep ourselves safe and to avoid infecting others. We are extremely pleased and honored that we have a renowned epidemiologist, Dr. Julia Marcus, who's an infectious disease epidemiologist and assistant professor at Harvard Medical School and the Harvard Pilgrim Healthcare Institute, talk to us tonight about what she sees as a scientist and a medical professional, about where we are in dealing with this pandemic and what the best answers right now are. We're going to be hearing from her about the spectrum of risk related to social interactions, how to minimize that risk. Before I introduce our presenters, please remember to keep your lines on mute if you're on the phone. After her presentation, I will moderate a Q&A. And again, we have questions that were submitted in advance. You can also submit questions through Facebook. Now it is my pleasure to introduce Dr. Julia Marcus, Assistant Professor, Harvard Medical School, and the Harvard Pilgrim Healthcare Institute. Good evening, Dr. Marcus.
Thank you for that introduction, and thanks so much for having me. I'll just start by telling you a little bit more about my background. I'm actually an HIV researcher. None of us were COVID researchers since COVID just arrived on the scene a few months ago. And what I study and research is HIV prevention. And so I've been kind of watching this pandemic unfold from the lens of the HIV epidemic, and particularly thinking about what happened in those early days when HIV first came on the scene, and we didn't even know it was HIV. We just knew there was this mysterious virus that was particularly affecting gay men, and there was a lot of confusion and a lot of fear. And at the time, the health advice that gay men were getting was to just be abstinent, just don't have sex. And I started to think about that over these past few months with the lockdown or stay-at-home orders, and think about how that was kind of playing out here with this abstinence-only approach to coronavirus prevention. And I think in early March, we really needed that kind of absolutist stay home message to catalyze a really substantial shift in our behavior and to flatten the curve. And that was very effective and necessary. But I think we all hoped it was going to be 2 weeks. And then it was like, oh, maybe it's going to be another couple weeks. And now here we are, and it's June, and we're realizing this is going to go on for quite some time. And now we have to think about how to live our lives sustainably with this new kind of scary virus. And I think we can accept that we can't just stay home forever. And so I think what's helpful is to think about a different framework. So risk is not binary. It's not that if we stay home, we're safe, and if we go out of our houses, we're unsafe. There's actually a whole range of activities. And let's say on the lowest risk end of the spectrum is just being at home alone or with your household members. And then at the highest risk end of the spectrum is, let's say, having a crowded indoor dinner party for several hours. And there's a lot in between those two things, and a lot of ways that we can try to still find some joy in life and find things to look forward to every day that are still keeping our risk of transmission, either acquiring the coronavirus or transmitting it to somebody else, trying to keep that risk as low as possible. And so I want to also talk for a minute about something called harm reduction, which I've written about this recently in The Atlantic. And this is kind of an alternative to an abstinence-only message. We know that abstinence-only messaging isn't effective for sex, and it's not going to be effective for social contact. So what can we do instead? Well, we can, with harm reduction, accept that some risk is going to happen. At this point, we are living with this virus. We can't eliminate risk. And harm reduction, instead of saying, all we're going to tell you about is just stay home, that's the safest thing, it accepts that some risk will happen and tries to keep risk as low as possible and give people tools to reduce any potential harms of the risks that they may choose to take. And I think another important part of harm reduction is that it accepts that there's a context in which people make choices around risk. Some people can't social distance because they have to go to work and they have to get a paycheck, and that's why people have talked about social distancing being a privilege. Or maybe people live in crowded housing and they really can't keep distance from their neighbors or even their household members when they need to. And some people just really need social contact because they've been very isolated and it's having an impact on their mental health. So how can we acknowledge those contextual factors and then help support people in choosing the lowest risk options that will be sustainable for them? And I also want to mention, at this point, we really don't have public health guidance that is along those lines. I will point to one example, which is from the New York City Health Department, which is, I think, very progressive in this way and forward thinking, that has put out guidance around sexual health, particularly in the COVID era. And it's a great example of harm reduction guidance that gives people a clear sense of what the safest thing is to do right now, but then also gives them a sense of what the next safest thing is and what the next safest thing is. And in each of those situations, gives people tools to reduce any potential harms if they do choose to engage in sexual activity outside of their household, let's say. And I think we really still need those kinds of guidelines, specifically for social contact. And right now, the messaging we're still getting from the CDC, even as places reopen, is stay 6 feet apart, wear a mask, wash your hands. And that's really important advice that we should all take to heart as much as possible. But people are asking questions about, well, what happens if I decide I want to be in a bubble with another family? My kids need to play with other kids. How do I start dating again? And these questions are not really being answered. And so I'm just going to share my screen for a second, and I definitely don't have all the answers, but I wanted to just share a couple infographics that just give a sense of the spectrum of risk that I'm talking about. So this was an infographic I just put together with another epidemiologist and posted on Twitter, just as an idea of what that spectrum might look like. So on the lowest risk end of the spectrum, you're at home alone or with your household members. A little bit, maybe taking a tiny bit of risk, but not much. You're walking, running, biking outdoors with other people. A little bit higher risk is a group gathering outdoors, but we know that outdoors is still lower risk than a group gathering indoors. And so you can kind of think about social contact on this spectrum and try to keep yourself at the lowest risk place you can be and still kind of get what you need in life. And we provided harm reduction tips that can be applied across most settings, wearing masks, trying to keep distance from people, keeping your hands clean, fewer people. So in general, the fewer contacts you have, the lower your risk will be. Ventilation is important, and that means if you are indoors, keep with people, keep the windows open, and really ideally just try to be outdoors as much as possible. And I know that that's more challenging in a place like New York City than some other places. And then staying home if sick is a key one. If you feel any symptoms or you think you may have been exposed to somebody, keeping yourself at home is really important for keeping your community safe. Keeping interactions brief is also important. We know that the longer that you spend with somebody, the higher risk that interaction becomes. And then just avoiding sharing food, drinks, toys, or sports equipment. So if you decide to meet up with people for a picnic, a socially distanced picnic, bring your own food so that you're not sharing utensils and potentially germs. And I also will just show you guys this Vox took that infographic and adapted it into this one that looks much more professional than ours, but it's basically the same idea of the spectrum of risk and ways that you can keep your risk as low as possible in every setting. And then finally, I'll show you Mark Levine, a city council member in New York City, also took this idea of the spectrum of risk and tried to apply it to all these different activities: walking, running, biking with a friend, picnic with friends in the park, etc. And assign each of these sort of like a stoplight color, yellow, red, or green, yellow, or red, to give people a sense of where it falls on that spectrum of risk. So I think I'll stop there and we can go to the Q&A. I think you might be on mute.
I am on mute. How embarrassing. Thank you.
Classic.
I say we're not really ready for CBS in the morning, but soon. I wanted to thank you for that. I really love the graphics, the ability to visualize this and start to understand. I think pictures do help people understand what is higher and lower risk and how important that is. So I'm just going to remind people, if they're watching by Facebook, they can type in questions, but I have a whole group of questions to ask you already. So I'm just going to get to those. I just switched my screen to that, sorry. All right. Can you discuss with us what the misinformation about COVID is that we should be ignoring? It's a hard question, but people feel like they're not getting reliable information, including maybe from the CDC and the World Health Organization, because people say they don't know what they're doing. So what should be our base for getting factual information that we can trust?
It's a really important question. There has been a lot of misinformation being shared in real time during this pandemic that unfortunately scientists have then had to spend a lot of time clarifying, and it's a distraction and a disservice. And I think one of the problems has been that we've been hearing a lot from politicians and not hearing as much from scientists, and particularly from the CDC. We really have not been hearing much from the CDC at all. And I would say the CDC it's a very trusted organization from my perspective, and full of brilliant, hardworking epidemiologists and physicians. And to the extent that we are hearing anything from the CDC, I would, they're not perfect, but I think they are a trusted source of information, and their website does have a lot of information on it, even though they have been fairly quiet in terms of the public eye. The WHO, also a trusted organization, although I will say there was a bit of a misfire the last few days with their communication around asymptomatic transmission. And in general, maybe I'll just tell you where I get my information, which is often, in addition to scientific journals, which I don't expect the public to be reading, I have chosen some very select scientific experts on Twitter to follow who are interpreting the science in real time. And if you are on social media, I would encourage you to try to find some experts that people have collected some lists of trusted experts, and really try to look towards scientists who are actively working on this and are not, not politicians. As much as politicians are wonderful and elected officials are incredibly important, I think for scientific information right now, look to scientists.
So let's say I have children and they've tested for having the antibodies to COVID. Can I really just go back to treating them just like they're a kid that you don't have to worry about anymore because they've had COVID and they have antibodies?
Yeah, unfortunately, antibody tests really don't tell us much of anything at this point. They are important from a research perspective, but I would really encourage people not to make any decisions based on the results of an antibody test at this point. A positive antibody test, if it is a true positive, and it may not be because the tests are not necessarily reliable, and there are many different ones out there, so it's not, I can't tell you exactly how reliable they are. It depends on the test you get. But even if somebody tests positive, it doesn't tell you that, it tells you that they were exposed to the virus. It doesn't tell you that they are immune or that they can't transmit it. We just don't know at this point. And so the best thing to do is not make any decisions about interaction with people based on the results of those antibody tests.
So you just showed us some examples of the lower risk and higher risk behaviors of being indoors versus outdoors and keeping your distance and shorter interactions. I know a lot of people I talk to who have young children are particularly concerned about the concept of letting their kids play in a park or play in a playground. They talk about young children don't understand instructions about keeping separate. They like to steal each other's toys. I have observed small children. It is true. They do like to steal each other's toys. How do you handle those issues when you're a parent trying to keep control of your children and yet want them to have normal interactions?
Yeah, some of these questions, there are no easy answers, probably most of them. And I empathize with that question as the mom of a 3-year-old and a 6-year-old who desperately need to be playing with other kids. And it's tough. I mean, we have tried to do a socially distanced play date, and the kids understand. And actually, I find that kids really adapt to rules very quickly, and they start policing the adults and saying, "You're not 6 feet apart," you know. But you also don't want to be policing them and saying, "No, don't touch that kid, don't touch their stuff." It makes it kind of a fraught experience for everyone. So I think we have to get creative and think about ways that kids can interact that are pretty distant. So one idea is going on a family bike ride with another family, and finding a place where you can meet up where there's open space or there's a path, and the two families can bike near each other or scoot or whatever contraption the kids are on. But have some distance. Or if the kids are small enough to be in strollers and be contained, that's another way to kind of be near another family and have kids near each other without interacting directly. But another option that I will mention that is not recommended at this point, except it's starting to be recommended in the Bay Area in California, is this idea of a social bubble, which some people have already chosen to do, and some other areas of the world, like New Zealand and some Canadian provinces, have actually recommended, because they're kind of they're epidemiologically they're kind of readier than we are to do this. But I just want to mention it as a way that, as a potential harm reduction strategy. So if somebody is like, "I can't do this anymore, I'm just going to start having dinner parties," one option that would be much safer than that would be finding another family that you could decide to essentially quarantine with, and communicating with them about what they're doing every day, what everybody's risk is, and the need for continued social distancing from other people, and keeping that risk communication open, and then deciding, okay, our kids are similar ages and they are going to play together and we're not going to worry about it. But we are going to be really vigilant about staying distant from other people. So that's one strategy I just wanted to mention. If a family gets to the point where they feel like their kids are really regressing or really struggling, that could be an option for kind of normal play dates while still keeping risk fairly low.
So 2 questions about more adult play things. And I'm going to roll them together, even though I'm not sure there is, but I'm just curious. So one of the questions is, how safe is it to play handball courts in the park? And another question is, how much risk is involved with playing billiards? Can you reduce your risk in playing billiards? And I was just going to point out, well, at least one of them is outdoors and one of them is indoors. But are these particularly safe or unsafe activities?
Well, I think you've already pointed out the key difference between those two activities, and that's, we know that risk of transmission is lower outdoors. Something like handball, I actually don't play handball, and I don't have a good vision of what a handball court looks like. But in general, I mean, if we think about tennis or even something like basketball, I would say that's a fairly low risk activity, you are potentially sharing equipment and touching a ball that somebody else has touched. And so just being conscious of keeping your hands clean is important. But it seems like those are potentially pretty well distanced activities. One thing I will mention, though, is that it does seem like there is a higher risk when people are exerting themselves. And if you're breathing heavily, let's say in an exercise class, that will increase risk of transmission. Billiards, you're not breathing heavily, probably, but it's indoors, and any length of time that you're spending indoors with other people, there is a risk of transmission. And I would say that's a situation where if you do choose to play billiards, I would definitely encourage masks, because that will be really important, especially if you're indoors with other people for an extended period of time.
So, perfect segue into masks. So, when larger groups of cyclists are given permission to ride together again, what will be some of the ways to reduce risk? I guess it's both between the cyclists and also between the cyclists and the people they are cycling past. I mean, should we expect cyclists to actually be wearing masks?
So I am not, I don't know what your local recommendations are, or, orders in terms of masks. They
Tell
vary.
everybody they should wear them. They don't always, but we tell them.
So in that case, I would say the risk of transmission from a passing cyclist is like really theoretical. I suppose it's possible, but I think that scientists are generally agreed that that's very unlikely. If you're in a tight pack of cyclists for an extended period of time, maybe there's a higher risk, but you're still outdoors. You're going through wind. It still seems pretty unlikely to me. But I will say that in terms of, just sort of social norms and making our community feel safe, it can be important to wear a mask, or at least have one available and visible, let's say around your neck, so that people, when they look out their windows, see masked people, and they see people ready to wear a mask so that they feel safe. I know in my own community, there have been some elderly people who have said, I'm afraid to leave my house because I see people outdoors not wearing masks. And also, I think we need better risk communication about, it being fairly low risk to just walk past somebody on the sidewalk, so that people don't feel like terrified of something that's fairly low risk. But again, I think masks do show others that we care about them and their safety. And so to the extent that you can wear a mask, I think it can kind of help that overall sense of community and collective action.
So now, a really big question for us here in New York City, if we're heading back to work, how are we going to feel confident we can get on the subways during peak travel times, get to and from our jobs, and protect ourselves?
Yeah, it's a big question, and I don't have all the answers there, but I will say masks are, again, very important.
And what about,
Some,
yeah, I'm sorry.
oh, go ahead. At both masks, and I would also say just being aware when you're touching high touch surfaces on public transit. In general, surfaces are not thought to be a major source of transmission, especially something like a package on your doorstep, or a takeout container. But if you're on the subway and 300 people have touched that same pole just before you, that does become riskier. And so making sure that you're being conscious about what you're touching is important. And also, people don't generally talk a whole lot on the subway. I think mostly these days people are staring at their phones, and there's not a whole lot of conversation. So that actually can keep risk lower when people are not having a lot of conversation. So I think the most important thing, again, is masks when you're in an enclosed setting. And to the extent that you can work off-peak hours to kind of reduce crowding overall in public transit, and I hope that workplaces will promote that, I think that can also help.
And what do you feel about people taking plastic gloves with them and using gloves of some sort when they're in a subway or a bus?
I think it can make sense for I'm commuting to work, I'm going to put on this pair of gloves, and then I'm going to dispose of it very carefully when I get to work. But just be aware that sometimes we wear gloves and kind of they become a second skin, and it doesn't really help anything if, let's say, you touch your face with your gloves on. It kind of defeats the purpose. And so just making sure that you're aware of that. And when you take them off carefully so you're not touching the outside and potentially contaminating your hands. And I think even then, it's still worth washing your hands.
So then I get to the office, and I have an open office plan. My employer says there's going to be fewer people in the office each day, and desks will be 6 feet apart. Yet I still can't imagine it's safe to be in a relatively small room all day with multiple coworkers. I'm afraid to go back to work and get sick and then bring it home to my family. Is there any real science there about how risky it is to go back to work in these situations?
Yeah, there have been some studies done looking at outbreaks that happened in office settings where people were in an open floor plan, and just through the shared air for an extended period of time, transmission did occur. So I think that workplaces need to be very conscious of how they can potentially restructure their environments to make them safer for people, and also think about making testing available. This kind of goes beyond, I've been talking a lot about individual decision making around social contact, but we also need these structural changes to our environments to make them as safe as possible. And I think an open floor plan office is a place where there does need to be some rethinking around how to make that a safer environment.
So we've also learned a lot about people who are in higher risk groups and lower risk groups. But what if it's a mix? So this person's question is, their husband is much older than them. In fact, the person asking is 50, her husband is 77. So she's been working remotely, but she's afraid to go back to her office when it opens because of her husband's age. Should she try to convince her boss that she needs to keep working from home in order to protect her family member, even though she's not necessarily in a high-risk group herself? Or is she overreacting somehow?
I don't think she's overreacting. I think her risk is her husband's risk, or her husband's risk is her risk. When you're in the same household, you share your risk is as high as the person who's out there in the world. And so I think if she's been successfully working from home for the past few months, maybe with some challenges, but if she's been able to do it, I would definitely encourage her to continue to do that, because she has a family member at home who's particularly vulnerable.
And is there a reason to be, so you were talking about sort of building these larger groups, but they're always the same people and you're checking each other and, if anyone's sick, so you're sort of expanding your immediate family group. So what's your feeling then about being invited over to someone else's house to play together if nobody seems to be sick? Is that like an okay thing to do, or should we still try to make sure we all stay outside together?
Yeah, I mean, I think if we think back to that spectrum of risk, an indoor group gathering is on the higher risk end of things. So some people may still choose to do that, and in that case, I would remind them of those harm reduction strategies around masks and keeping our hands clean and trying to keep some distance. But once you're indoors in a group of people, the risk definitely does go up. So I think to the extent that you can meet people outdoors, that will keep risk lower. And also, again, this bubble strategy of trying to see the same people and trying to find a very small group of people that kind of satisfies your needs. Let's say you have kids, trying to find another family that has kids similar ages, to overall reduce the number of contacts that you have. So the idea here is not to go back to the way our lives looked before COVID. The idea is to find a new normal that we can tolerate, that we can live with, until we have an effective vaccine. A normal that will give us enough social contact to sustain us, but still keep risk low. So it might be that we don't see as many people as we're used to seeing, or maybe we see one other family for 3 weeks and then we take a break and then we choose to see another family for 3 weeks. There might be some ways that we need to get creative here, but keeping your overall number of contacts low is going to be a really important strategy for keeping risk low.
So sometimes, at least here in New York, we get these sort of news stories that pop out and we think, oh, a whole new giant problem. And then you wait a couple of days and you forget that that was a whole new giant problem. So two examples. One, we had these stories about young children seeming to develop particularly scary illness sort of starting as COVID and then shifting into some other disease patterns that adults weren't seeing. Have they tracked that down now? Is there more of that happening and we're just not hearing about it?
To be honest, I am not up to date on what's happening with that, so I'm gonna hold off on commenting on it because I don't want to be a source of misinformation.
Okay. I know that's one of the concerns about, the reopening of schools and allowing children to get together with friends and play, that now parents who thought, oh, children are sort of just going to breeze through this, maybe not so much. So that's a concern. Then there's another story or stories that if you are blood type O, you are much less at risk of getting COVID than if you're A or AB. And I'm curious whether that should be some type of evaluation for ourselves when deciding how much risk we might be to others or to ourselves being exposed.
As far as I know, your blood type would not be a reason to make decisions differently around social contact.
Okay, thank you. So suppose you've had someone who used to come and clean your home, and then you stopped having them come to clean your home because of COVID, but you're exploring whether you can rehire them. You really would like to rehire them, and I'm sure they would really like the work. But are there special precautions that one needs to factor in when inviting someone into your home?
Yeah, I think there's some, that's an important question that many of us are thinking about. And I think the key thing would be to not be in your house when the person or people come to clean it. And if you can find a way to pay them remotely and just avoid all in-person interaction, I think that would keep risk fairly low. And if you ask them to, let's say, wear gloves and wear a mask while they're cleaning your house, it seems to me that it would be very unlikely for any kind of transmission to occur by, let's say, them coughing on a surface in your house and then you touching it and then touching your face. It's kind of a long chain of events that would need to happen that seems fairly unlikely. And again, I don't want to say it's impossible, but I think as long as there's no in-person contact, that's a fairly low risk activity.
So let's say I'm that same person. So now I'm going to leave my home so that someone can come in and clean my home. But I've been very frightened about the common areas of my building. Our hallways are a risk to me, elevators, going to the laundry room to do my laundry, even handling my own doorknobs and pushing elevator buttons. Is there some way for me to perhaps get past my fear of even leaving my home by some handy hints about why either I shouldn't be that worried or what I can do about it to decrease my.
Yeah, I think that fear is kind of a side effect of that absolutist messaging that made us feel like if we stayed home, we would be free of COVID, and if we left our houses, we would get it. And actually touching a doorknob, touching the elevator button, and just walking past somebody in the hallway, those are all fairly low risk as long as you're conscious of keeping your hands clean. Bring hand sanitizer in your pocket to use after you touch all those surfaces. I always try to push the elevator button with my elbow. Things like that. That just be aware. But I think trying to remember that what scientists consider to be a high-risk contact is being fairly close to somebody for an extended period of time. So it's not just these passing interactions, and it's not surfaces. And again, you want to be conscious of those, but not be crippled by fear, and feel like you can't leave your house.
So now more on the opposite end of that spectrum. What about the people who just can't wait to go find someone to cut their hair or color their hair or give them a massage? And I would fall into all those categories, by the way. Um, are we being too high risk by saying we are able to go out and do that safely, or are there things we better think about before we sign up for those activities?
Yeah, I mean, I think it's tough because places are going to reopen and people are still going to be navigating what they're personally comfortable with in terms of risk. And in terms of individual decision making, assessing the risks and the benefits, I think, can be helpful. So with haircuts, we know you're indoors and you're near somebody for an extended period of time. But there was a very encouraging story recently about a hairdresser who did have coronavirus infection and continued to cut hair, and everybody wore masks, and the hairdresser saw many, many clients, and none of them were infected. And so I think it suggests that masks can really reduce risk. And so I think, in this situation, the way I would go about it is thinking, what are my risks here and how can I reduce them? Okay, wearing a mask can reduce risk. Maybe getting a haircut but not coloring my hair so that I'm in the salon for less time and keeping that interaction briefer. And actually, what is the benefit? Do I really need the haircut? Maybe I don't really care about the haircut, but what I really want is to see this friend and go for a walk with them. And so I'd rather take that risk and try to kind of think about your overall cumulative risk and prioritize and make choices about what's really going to benefit you, and not just, what you used to do and what was normal, but what's really important to you now.
And I don't know whether this is anecdotal or true, but I've been told that there are lines of people in certain of our parks standing there waiting for the outdoor haircuts that somebody has creatively decided to bring their business model, which I think still is not legal, and I'm pretty sure we don't have exceptions for parks. But I thought, oh, that's very innovative because you're not indoors. The hair blows away, probably not that big a deal from a environmental problem outcome. So I don't know, maybe the city of New York will come along with a plan along with outdoor eating options to do outdoor hair options, which might actually address the points you're making and give people some greater comfort that they can get this done. But you're absolutely right. Maybe you should prioritize the walk with your friends instead. Okay, next really complicated topic. And I do remember from the pictures, it's high risk. Young people, dating. How do we go back? I mean, I'm a very old, established married woman, so I'm probably not going back to dating. But how do young people, single people, revisit the concept of dating, which usually ends up involving physical contact with new people in their lives?
Yeah, it's a really important question, and I think it can be navigated kind of similarly to social contact. And I would actually refer people to an article in the New York Times today that was reporting on the new New York City safer sex COVID guidelines, and talking about some of these issues. I think it's the same principles of trying to reduce your overall number of contacts. It's challenging with dating, because now, as I talked to the reporter for that article, and I told her now it's like you have to have the safer sex conversation before you even kiss on that first date. There's risk to much less intimate contact, and so we kind of have to shift the way that we have those conversations. And hopefully people can be open about what kind of risk they might have, and maybe some early dates are going to be outdoor walks. And then when it gets to the point where people want to have physical intimacy, there needs to be that conversation around potential risk. And I would say overall, the key is going to be having one partner at a time, and just overall reducing your number of contacts. And I'll also mention that the Netherlands, which is far more progressive about these things than the US, has actually recommended that people find one sex buddy, one quarantine sex buddy, acknowledging that people may need sexual contact and they may be single and be living alone. So they say, okay, fine, we acknowledge that you need that. Just try to find one person. And so that's a strategy you can use that's similar to this household bubble strategy. That's trying to keep your number of contacts low and keep risk communication open.
And there's been quite a bit of conversation in New York over the last few days, and maybe the other major cities, that with all the protests that have been going on, there was not that much social distancing being practiced, and there were, in observation, significant numbers of both protesters and police officers that didn't have masks during all of these interactions. Do you suspect we're going to see a jump in new cases of COVID starting very soon because of the timing of when the protests were and the schedule we're on?
Yeah, I would be surprised if there are no new cases attributable to people gathering in these protests. And I'm particularly concerned about people being detained in jail overnight. And I know hundreds, actually thousands at this point, of people were arrested in New York and detained. And that's where we're most concerned, is those crowded indoor settings. And I think to the extent that we can give protesters tips to keep their risk as low as possible, but also communicate to police the importance of not using strategies that are going to increase risk, like corralling people into crowds, detaining people on buses and detaining them in jails, and of course the use of tear gas that makes people tear off their masks and cough. These are all ways that we may be increasing transmission in these settings. And it's an unfortunate reality that there was this uprising at the same time as the pandemic, but we cannot stop it, I think, as public health professionals. So the best we can do is try to reduce risk as much as possible. And I'll also say, if there are increases in cases in the coming weeks, I think it's going to be difficult to know what caused that. Many places are reopening at least partially or fully, and that started before the protests. And so we're already starting to see some increases in cases in places that have been reopening. And so I would caution people to not necessarily attribute increases to the protests, which started after that.
So going back to the public transportation that people, I think, really have so much concern about. If you're in a bus and the bus driver isn't wearing a mask, or you get onto a subway car and you're seeing other people not wearing masks, do you think there's a way to politely but strongly advise them that really, for everybody's sake, they need to be following the rules, they need to be wearing masks? You just get up and leave the bus, leave the subway if you see that they're not? Do you have advice about almost the social interactions to deal with when you're trying to get from point A to point B? And, we're a city of subway and bus takers. That's how we function. But they're all enclosed and they're all a little too crowded most of the time. So do you have any helpful hints to advise us on?
It may go beyond my expertise as an epidemiologist, but I think I could say what probably won't be effective is yelling at people or shaming them. That tends to not have the effect that we want it to have. I think if the city, or if states can help by providing masks, let's say, on public transit. So let's say the driver has a box of masks, and if somebody gets on and doesn't have one, they just get handed a mask. Find ways to kind of support mask wearing without necessarily putting the burden on each individual to always have a mask at all times. We know some people are resistant to the idea of masks, but some people may just forget, or maybe their mask got soiled and they threw it away and they need to get home from work. So I think if we can help as kind of as a city or a state or public health officials, I think that would alleviate some of that burden on individuals to be navigating those situations.
And I think actually New York City is trying to do a very good job with that. They're doing mass distributions of masks out just near parks and other places people might be getting together. Um, you know, government officials are offered large quantities for us to distribute, which my staff have been running around to senior centers and community houses to give out masks so that they have them to share with people. But that's a very good idea that you actually have them as you're going in and out of the subway system, buses, so that situation doesn't have to escalate. You can just hand someone the mask and
Right.
hope that they will go, oh, yeah, that's right, I should put this on. Um, well, I'm just going to look over here at the questions. You don't understand why I'm looking over here, but it's on the right side of my screen to make sure I covered the questions that people have been typing in. I think I've covered those questions as well as the questions we had written down. And we're very close to what I'm supposed to be actually saying thank you to you. So I'm going to say thank you so much for joining us tonight. Thank you for the work you are doing that matters so much to everyone who's having to learn to live through and survive a new pandemic. And I suspect, oh, I did have one more question. Do you believe that this is a wave of new diseases we might be seeing that might be caused by climate change or some other patterns, and that we all need to learn the lessons here, but be prepared for something else coming down the line?
I don't know. I think scientists have been expecting a global respiratory virus pandemic for quite some time, and I think it wasn't shocking. So I don't know that it's necessarily related to climate change, but we do know that scientists predict that climate change could bring on more, could increase infectious diseases, and it is possible that we will see more of this in the future. I certainly hope not, though.
Either, but my gut is that we probably should all be preparing um, to, I guess, be smarter about it earlier if suddenly we are told, oh, there's some disease pattern that we're seeing out there, maybe not in the US right now, or maybe not in your state, but that being ready is clearly a better place for us to be, even though I hope that,
Absolutely.
even though I hope that we don't ever have to be again. So I think I just want to thank you again so much for sharing your expertise with us tonight and taking time out of your and your family's life to be with us. I want to share that next week we're going to have two virtual town hall meetings. Part two of this series, which will be on testing, tracing, and taking care, T3, tracking down the virus, which will be held on Wednesday, June 17th at 7 p.m., where I'll be joined by Dr. Ted Long, Executive Director of the Test and Trace Corps, and Dr. Dimitri Daskalakis, next week I'll learn to pronounce it correctly, Deputy Commissioner of New York City Department of Health and Mental Health, for a discussion of the program, how it's being operated, and the integral role that this program will serve in helping to contain COVID-19 infections. And then the next day, Thursday, June 18th, we're going to hold a special town hall meeting about the package of criminal justice legislation that we just passed in Albany, with several experts in that show as well. We'll be sending additional details out soon about how to register. And again, in closing, I want to remind everyone Stay well, stay safe, wear face coverings, try to stay 6 feet apart from others, and follow the doctor's advice about keeping your risk low, even if perhaps it's impossible to protect yourself 100%. Thank you, everyone. Good night.